It's been a long 14 months as our community, along with the nation and the entire world, has endured the COVID-19 pandemic. Collectively, our Chesterfield team, comprised of numerous departments and hundreds of employees, have worked tirelessly from the start. Our goal was straightforward: to provide you, our residents, with the most current resources, information, and access to COVID-19 testing to safeguard you and your family. That's why, at the beginning of the pandemic, Chesterfield built a webpage to serve as a central resource to link residents with pertinent information about the virus, and partnered with the Chesterfield Health District to assist with hosting COVID-19 testing clinics. As the pandemic continued and the Virginia Department of Health began to roll out the vaccines, like many localities, Chesterfield needed to first focus on getting as many first responders, teachers, residents, businesses, and employees vaccinated in accordance with the state eligibility standards. However, by law, we were limited as to the role our county could play in the vaccination process. Therefore, we entered into a unique agreement with the Virginia Department of Health's Chesterfield Health District to help administer vaccines throughout the entire health district, which includes Chesterfield, Powhatan, and Colonial Heights. This agreement, to my knowledge, made us the first locality in Virginia legally authorized to share our technological, logistical, and customer service expertise with the Chesterfield Health District. While supply of the COVID-19 vaccines at the beginning was a huge obstacle nationwide, Chesterfield worked closely with VDH to vaccinate as many residents as quickly as possible with the inventory available. The county response was reliant on the collective effort, energy, and talent of many departments coming together in order to deliver the quickest and easiest access to vaccines in our community. Our team was able to provide clinic assistance, including all logistical, technological, registration, and mobility service support, while delivering extensive public information outreach and mental health campaigns. The county has made significant progress towards reaching the community vaccination goal, highlighted by the fact that for residents who wanted a vaccine have received at least one dose, and all of those still seeking a vaccine should be able to schedule a same-day appointment or walk-in wherever offered. As of June 22nd, we've reached nearly 89% of our goal, equating to almost 190,000 residents who have been vaccinated. While we continue to work towards our community vaccination goal and are coming to the end of the pandemic with the local state of emergency concluding June 30th, as a community, we need to still stay focused on keeping our families and communities safe. This can only be accomplished by continuing to come together. As I said, it's been a long 14 months, but your local government and our community as a whole has shown its resolve by tackling a major public health issue together. And each and every day, our community continues to show its resilience as businesses open up and life gets back to pre-pandemic times as we all move forward after enduring one of the biggest public health challenges of our lifetime. Thank you to our county and school employees, and especially thank you to our residents, because we have all been in this together.
I want to echo Dr. Worsley's words, because getting on the other side of this pandemic has really been a result of all of us coming together, which includes the partnership between the Virginia Department of Health and Chesterfield County. However, it's important to note that the progress we have made is also a result of our community coming together during the pandemic to support our COVID-19 testing and vaccination efforts. Since the beginning of the year, VDH has been distributing the COVID-19 vaccines to Virginians across the state. We move through the vaccine distribution phases by vaccinating as many people as possible based on the state's eligibility requirements. And as the supply of vaccine increased, we modified processes to make it easier to schedule an appointment. With eligibility parameters expanding the age of who can receive a COVID-19 vaccine to include children as young as 12, our top priority is still to get as many shots in as many arms as possible. While some have shared concerns about children receiving the vaccine, it is up to parents and children to make the decision, and studies have shown that it is safe.
It was mainly important for me because I wanted to protect both myself and the people around me, namely my mom and my grandma, who are high risk. And I thought it was just important to do my part and get vaccinated to kind of end this entire pandemic,
I think it's important for other people to get vaccinated so they can go back to school like they did. I know some people don't like school, but because going to school is kind of just a monumental thing for people, especially in high school, so I think people should get it so they just be normal again.
As we see the signs of the pandemic diminish, we need to keep in mind that this is largely due to many people already being vaccinated. Again, it is a personal choice as to whether the COVID-19 vaccine is right for you. Please know that if you have questions about the vaccine or want to schedule an appointment, you can contact your pharmacy or go to vaccinate.virginia.gov. The Chesterfield Health District will continue to focus on making the COVID-19 vaccine accessible, especially to some of our more vulnerable populations in our community. That is why we have deployed mobile vaccination units and have held smaller scale clinics in parks and other places in the county where access to health care might be a challenge. Recently, we opened the Rockwood Vaccination Center in the former Big Lots store at the Rockwood Shopping Center to provide more flexibility to those who are working and to provide an opportunity for rising 7th through 12th graders to receive other vaccinations required for school admission. This fixed vaccination clinic does not require an appointment and walk-ups are welcome. If you are interested in learning more about this vaccination clinic, I encourage you to visit our webpage.
As we were preparing for the vaccine rollout, we learned that the local health districts were going to be responsible for vaccinating most of the population who were not affiliated with healthcare systems or long-term care facilities. Knowing this was going to be a large undertaking, Chesterfield County Fire and EMS and the Employee Medical Center partnered with the Chesterfield Health District to assist in providing vaccines to county public safety, government, and school employees. As vaccine supply increased, we expanded our efforts to include state public safety agencies, private schools and daycares, and other local businesses so that the health district could focus on vaccinating the community at large.
We were able to get in with Chesterfield County to get all of our employees vaccinated, which we were super excited about.
With the county's help and just how easy it was to sign up online, I think it put the employees at ease. They knew exactly where to go, and then the day of the vaccination, they just walked right in to the registration desk. They got their vaccination, and everybody was surprised at how seamless it was.
A need was also identified in our community for residents who were bedbound, as well as those who could not leave their homes due to severe and chronic conditions. The Chesterfield Fire and EMS Mobile Integrated Health Unit led efforts in providing vaccines to those residents in their homes. In total, the bedbound program vaccinated 325 of our most vulnerable residents who otherwise may have had to wait or would have not had the opportunity at all to be vaccinated. The partnership between the Chesterfield Health District and Chesterfield County government proved successful in expediting the vaccine administration to our community.
While the pandemic is almost over, our partnership with Chesterfield is ongoing and will allow us to continue to serve our residents to the fullest. Remember to take precautions and to know that your Chesterfield Health District is here to support Chesterfield residents and the entire health district. Thank you.